Section 23 of Gray's Anatomy Part 3. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Ellie. Anatomy of the Human Body, Part 3, by Henry Gray. 1. The hypogastric artery. Arteria hypogastrica, internal iliac artery. The hypogastric artery supplies the walls and the viscera of the pelvis, the buttock, the generative organs, and the medial side of the thigh. It is a short, thick vessel, smaller than the external iliac, about 4 centimeters in length. It arises at the bifurcation of the common iliac, opposite the lumbosacral articulation, and passing downward to the upper margin of the greater sciatic foramen, divides into 2 large trunks, an anterior and a posterior. Relations. It is in relation in front with the ureter. Behind is the internal iliac vein, the lumbosacral trunk, and the piriformis muscle. Laterally, near its origin, is the external iliac vein, which lies between it and the psoas major muscle. Lower down is the obturator nerve. In the fetus, the hypogastric artery is twice as large as the external iliac, and is the direct continuation of the common iliac. It ascends along the side of the bladder and runs downward on the back of the anterior wall of the abdomen to the umbilicus, converging towards its fellow of the opposite side. Having passed through the umbilical opening, the 2 arteries, now termed umbilical, enter the umbilical cord, where they are coiled around the umbilical vein, and ultimately ramify in the placenta. At birth, when the placental circulation ceases, the pelvic portion only of the artery remains patent, and constitute the hypogastric and the first part of the superior vesical artery of the adult. The remainder of the vessel is converted into a solid fibrous cord, the lateral umbilical ligament, obliterated hypogastric artery, which extends from the pelvis to the umbilicus. Peculiarities as regards length. In 2/3 of a large number of cases, the length of the hypogastric varied between 2.25 and 3.4 centimeters. In the remaining third it was more frequently longer than shorter, the maximum length being about 7 centimeters, the minimum about 1 centimeter. The length of the common iliac, the hypogastric arteries be in inverse proportion to each other, the hypogastric artery being long when the common iliac is short, and vice versa. As regards its place of division. The place of division of the hypogastric varies between the upper margin of the sacrum and the upper border of the greater sciatic foramen. The right and left hypogastric arteries in a series of cases often differed in length, but neither seemed constantly to exceed the other. Collateral circulation. The circulation of the ligature of the hypogastric artery is carried on by the anastomosis of the uterine and ovarian arteries, of the vesical arteries of the 2 sides, of the hemorrhoidal branches of the hypogastric with those from the inferior mesenteric, of the obturator artery by means of its pubic branch, with the vessel of the opposite side, and with the inferior epigastric and medial femoral circumflex, of the circumflex and perforating branches of the profunda femoris, with the inferior gluteal, of the superior gluteal with the posterior branches of the lateral sacral arteries, of the iliolumbar with the last lumbar, of the lateral sacral with the middle sacral, and of the iliac circumflex with the iliolumbar and superior gluteal. Branches. The branches of the hypogastric artery are, from the anterior trunk, superior vesical, little vesical, inferior vesical, little hemorrhoidal, obturator, internal padental, inferior gluteal. In the female, uterine, vaginal. From the posterior trunk, iliolumbar, lateral sacral, superior gluteal. The superior vesical artery, arteria vesicalis superior, supplies numerous branches to the upper part of the bladder. From one of these slender vessels, the artery of the ductus deferens takes origin and accompanies the duct in its course to the testis, where it anastomoses with the internal spermatic artery. Other branches supply the ureter. The first part of the superior vesical artery represents the terminal section of the pervious portion of the fatal hypogastric artery. The middle vesical artery, arteria vesicalis medialis, usually a branch of the superior, is distributed to the fundus of the bladder and the vesiculae seminales. The inferior vesical artery, Artery vesicalis inferior, frequently arises in common with the middle hemorrhoidal and is distributed to the fundus of the bladder, the prostate, and the vesiculae seminalis. The branches of the prostate communicate with the corresponding vessels of the opposite side. The middle hemorrhoidal artery, Arteria hemorrhoidalis media, usually arises with the preceding vessel. It is distributed to the rectum, anastomosing with the inferior vesicle and with the superior and inferior hemorrhoidal arteries. It gives offsets to the vesiculae seminalis and prostate. The uterine artery, Arteria uterina, springs from the anterior division of the hypogastric and runs medialward on the levata ani and toward the cervix uteri. About 2 centimeters from the cervix, it crosses above and in front of the ureter, to which it supplies a small branch. Reaching the side of the uterus, it ascends, in a tortuous manner, between the 2 layers of the broad ligament to the junction of the uterine tube and uterus. It then runs lateralward toward the hilus of the ovary, and ends by joining the ovarian artery. It supplies branches to the cervix uteri and others which descend to the vagina. The latter anastomose with branches of the vaginal arteries, and form with them 2 median longitudinal vessels. The assigus arteries of the vagina, one of which runs down in front of the vagina and the other behind. It supplies numerous branches of the body of the uterus, and from its terminal portion twigs are distributed to the uterine tube and the round ligament of the uterus. The vaginal artery, Arteria vaginalis, usually corresponds to the inferior vesicle in the male. It descends upon the vagina, supplying its mucous membrane, and sends branches to the bulb of the vestibule, the fundus of the bladder, and the contiguous part of the rectum. It assists in forming the assigus arteries of the vagina, and is frequently represented by 2 or 3 branches. The obturator artery, Arteria obturatoria, passes forward and downward on the lateral wall of the pelvis, and to the upper part of the obturator foramen, and, escaping from the pelvic cavity through the obturator channel, it divides into an anterior and a posterior branch. In the pelvic cavity, this vessel is in relation, laterally, with the obturator fascia, medially with the ureter, ductus deferens, and peritoneum, while a little below it is the obturator nerve. Branches. Inside the pelvis, the obturator artery gives off the iliac branches to the iliac fossa, which supply the bone and the iliacus, and anastomose is the iliolumbar artery, a vesical branch which runs backward to supply the bladder, and a pubic branch, which is given off from the vessel just before it leaves the pelvic cavity. The pubic branch ascends upon the back of the pubis, communicating with the corresponding vessel of the opposite side and with the inferior epigastric artery. Outside the pelvis, the obturator artery divides at the upper margin of the obturator foramen into an anterior and a posterior branch, which encircle the foramen under the cover of the obturator externus. The anterior branch, which runs forward on the outer surface of the obturator membrane and then curves downward along the anterior margin of the foramen, distributes branches to the obturator externus, pectineus, adductores, and gracilis, and anastomosis with the posterior branch and with the medial femoral circumflex artery. The posterior branch follows the posterior margin of the foramen and turns downward on the inferior ramus of the ischium, where it anastomoses with the anterior branch. It gives twigs to the muscles attached to the ischial tuberosity, and anastomoses with the inferior gluteal. It also supplies an articular branch which enters the hip joint through the acetabular notch, ramifies in the fat of the bottom at the acetabulum, and sends a twig along the ligamentum teres to the head of the femur. Peculiarities. The obturator artery sometimes arises from the main stem or from the posterior trunk of the hypogastric, or it may spring from the superior gluteal artery. Occasionally it arises from the external iliac. In about 2 out of every 7 cases it springs from the inferior epigastric and descends almost vertically to the upper part of the obturator foramen. The artery in its course usually lies in contact with the external iliac vein, and on the lateral side of the femoral ring. In such cases it would not be endangered in the operation for strangulated femoral hernia. Occasionally, however, it curves along the free margin of the lanucular ligament, and if in such circumstances a femoral hernia occurred, the vessel would almost completely encircle the neck of the hernial sac, and would be in great danger of being wounded if an operation were performed by strangulation. The internal prudental artery, Arteria pudenta interna, internal pubic artery, is the smaller of the two terminal branches of the interior trunk of the hypogastric, and supplies the external organs of generation. Though the course of the artery is the same in the two sexes, the vessel is smaller in the female than in the male, and the distortion of its branch is somewhat different. The description of its arrangement in the male will first be given, and subsequently the difference which it presents in the female will be mentioned. The internal potential artery in the male passes downward and outward of the lower border to the greater sciatic foramen, and emerges from the pelvis between the piriformis and the coccygus. It then crosses the ischial spine and enters the perineum through the lesser sciatic foramen. The artery now crosses the obturator internus along the lateral wall of the ischiorectal fossa, being situated about 4 centimeters above the lower margin of the ischial tuberosity. It gradually approaches the margin of the inferior ramus of the ischium and passes forward between the two layers of the fascia of the urogenital diaphragm. It then runs forward along the medial margin of the inferior ramus of the pubis, and about 2.25 centimeters behind the pubic accurate ligament it pierces the inferior fascia of the urogenital diaphragm, and divides into the dorsal and deep arteries of the penis. Relations. As in the pelvis, it lies in front of the piriformis muscle, the sacral plexus of nerves, and the inferior gluteal artery. As it crosses the ischial spine, it is covered by the gluteus maximus, and overlapped by the sacrotuberous ligament. Here the potential nerve lies to the medial side, and the nerve of the obturator internus to the lateral side of the vessel. In the perineum it lies on the lateral wall of the ischiorectal fossa, in a canal, Alcock's canal, formed by the splitting of the obturator fascia. It is accompanied by a pair of venae comitantes and the potential nerve. Peculiarities. The internal potential artery is sometimes smaller than usual, or fails to give off one or two of its usual branches. In such cases the deficiency is supplied by branches derived from an additional vessel, the accessory potential, which generally arises from the internal potential artery before its exit from the greater sciatic foramen. It passes downward along the lower part of the bladder, and across the side of the prostate to the root of the penis, where it perforates the urogenital diaphragm, and gives off the branches usually derived from the internal potential artery. The deficiency most frequently met with is that in which the internal potential ends as the artery of the urethral pulp, the dorsal and deep arteries of the penis being derived from the accessory potential. The internal potential artery may also end as the perineal, the artery of the urethral bulb being derived, with the other two branches, from the accessory vessel. Occasionally the accessory potential artery is derived from one of the other branches of the hypogastric artery, most frequently the inferior vesicle or the obturator. Branches. The branches of the internal potential artery are muscular, inferior hemorrhoidal, perineal, artery of the urethral pulp, urethral, deep artery of the penis, dorsal artery of the penis. The muscular branches consist of two sets, one given off in the pelvis, the other as the vessel crosses the ischial spine. The former consists of several small offsets, which supply the levator ani, the obturator internus, the piriformis, the coccygus. The branches given off outside the pelvis are distributed to the adjacent parts of the gluteus maximus and external rotator muscles. The anastomose with branches of the inferior gluteal artery. The inferior hemorrhoidal artery, arteria hemorrhoidalis inferior, arises from the internal potential as it passes above the ischial tuberosity. Piercing the wall of Alcock's canal, it divides into 2 or 3 branches which cross the ischiorectal fossa and are distributed to the muscles and integument of the anal region, and send offshots around the lower edge of the gluteus maximus to the skin of the buttock. The anastomose is the corresponding vessels of the opposite side, with the superior and the middle hemorrhoidal, and with the perineal artery. The perineal artery, arteria perinei, superficial perineal artery, arises from the internal potential in front of the preceding branches and turns upward, crossing either over or under the transversus perinei superficialis, and runs downward parallel to the pubic arch in the interspace between the bulbocavernosus and the ischiocavernosus, both of which it supplies, and finally divides into several posterior scrotal branches, which are distributed to the skin and dartos tunic of the scrotum. As it crosses the transversus perinei superficialis, it gives off the transverse perineal artery, which which runs transversely on the cutaneous surface of the muscle, and anastomosis with the corresponding vessel of the opposite side, and with the perineal and inferior hemorrhoidal arteries. It supplies the transversus perineae superficialis, the structures between the anus and the urethral bulb. The artery of the urethral bulb, arteria bulbi urethrae, is a short vessel of a large caliber which arises from the internal pudendal between the two layers of fascia of the urogenital diaphragm. It passes medialward, pierces the inferior fascia of the urogenital diaphragm, and gives off branches which ramify in the bulb of the ureter, and in the posterior part of the corpus cavernosum urethrae. It gives off a small branch to the bulbourethral gland. The urethral artery, arteria urethralis, arises a short distance in front of the artery of the urethral bulb. It runs forward and medialward, pierces the inferior fascia of the urogenital diaphragm, and enters the corpus cavernosum urethrae, in which it is continued forward to the glans penis. The deep artery of the penis, arteria profunda penis, artery of the corpus cavernosum, one of the terminal branches of the internal pudendal, arises from that vessel, while it is situated between the two fasciae of the urogenital diaphragm. It pierces the inferior fascia, and entering the crushed penis obliquely, runs forward in the centre of the corpus cavernosum penis, to which its branches are distributed. The dorsal artery of the penis, arteria dorsalis penis, ascends between the crus penis and the pubic symphysis, and piercing the inferior fascia of the urogenital diaphragm, passes between the two layers of the suspensory ligament of the penis, and runs forward on the dorsum of the penis to the glans, where it divides into two branches, which supply the glans and the prepuce. On the penis it lies between the dorsal nerve and the deep dorsal vein, the former being on its lateral side. It supplies the integument and fibrous sheath of the corpus cavernosum penis, sending branches through the sheath to anastomose with the preceding vessel. The internal pudendal artery in the female is smaller than in the male. Its origin and course is similar, and there is considerable analogy in the distribution of its branches. The perineal artery supplies the labia putendi, the artery of the bulb supplies the bulbus vestibuli and the erectile tissue of the vagina, and the deep artery of the clitoris supplies the corpus cavernosum clitoris, and the dorsal artery of the clitoris supplies the dorsum of the organ, and ends in the glans and prepubis of the clitoris. The inferior internal gluteal artery, arteria glutea inferior, sciatic artery, the larger of the two terminal branches of the anterior trunk of the hypogastric, is distributed chiefly to the buttock and back of the thigh. It passes down on the sacral plexus of nerves and the piriformis, behind the internal pudendal artery, the lower part of the greater sciatic foramen, through which it escapes from the pelvis, between the piriformis and the coccygus. It then descends in the interval between the greater trochanter of the femur and tuberosity of the ischium, accompanied by the sciatic and posterior femoral cutaneous nerves, and covered by the gluteus maximus, and is continued down the back of the thigh, supplying the skin and anastomosing with the branches of the perforating arteries. Inside the pelvis it distributes branches to the piriformis, coccygus, and levator ani, some branches which supply the fat around the rectum and occasionally take the place of the middle hemorrhoidal artery, and vesical branches to the fundus of the bladder, vesiculae seminalis, and prostate. Outside the pelvis it gives off the following branches: muscular, coccygeal, committens nervi ischiadici, anastomotic, articular, cutaneous. The muscular branches supply the gluteus maximus, anastomosing with the superior gluteal artery in the substance of the muscle, the external rotators anastomosing with the internal pudendal artery, and the muscles attached to the tuberosity of the ischium anastomosing with the posterior branch of the obturator and the medial femoral circumflex arteries. The coccygeal branches run medialward, pierce the sacrotuberous ligament, and supply the gluteus maximus, the integument, and other structures on the back of the coccyx. The arteria committens nervi ischiadici is a long, slender vessel, which accompanies the sciatic nerve for a short distance. It then penetrates it, and runs in its substance to the lower part of the thigh. The anastomotic is directed downward across the external rotators, and assists in forming the so-called crucial anastomosis, by joining with the first perforating and medial and lateral femoral circumflex arteries. The articular branch, generally derived from the anastomotic, is distributed to the capsule of the hip joint. The cutaneous branches are distributed to the skin of the buttock and back of the thigh. The iliolumbar artery, arteria iliolumbalis, a branch of the posterior trunk of the hypogastric, turns upward behind the obturator nerve and the external iliac vessel to the medial border of the psoas major, behind which it divides into a lumbar and an iliac branch. The lumbar branch, ramus lumbalis, supplies the psoas major and the quadratus lumborum, anastomosis with the last lumbar artery, and sends a small spinal branch through the intervertebral foramen, between the last lumbar vertebra and the sacrum, into the vertebral canal, to supply the cauda equina. The iliac branch, ramus iliacus, descends to supply the iliacus. Some offsets running between the muscle and the bone anastomose with the iliac branches of the obturator. One of these enters an oblique canal to supply the bone, which others run along the crest of the ilium, distributing branches to the gluteal and abdominal muscles, and anastomosing in their course with the superior gluteal, iliac circumflex, and lateral femoral circumflex arteries. The lateral sacral arteries, arteria sacralis lateralis, arise from the posterior division of the hypogastric. There are usually two, a superior and an inferior. The superior, of large size, passes medialward, and after anastomosing these branches from the middle sacral, enters the first or second anterior sacral foramen, supplies branches to the contents of the sacral canal, and, escaping the corresponding posterior sacral foramen, is distributed to skin and muscle of the dorsum of the sacrum, anastomosing with the superior gluteal. The inferior runs obliquely across the front of the piriformis and the sacral nerves of the medial side of the anterior sacral foramina, descends on the front of the sacrum and anastomoses over the coccyx, with the middle sacral and opposite lateral sacral artery. In its course it gives off branches, which enter the anterior sacral foramina. These, after supplying the contents of the sacral canal, escapes by the posterior sacral foramina, and are distributed to the muscles and skin of the dorsal surface of the sacrum, anastomosing with the gluteal arteries. The superior gluteal artery, arteria glutea superior, gluteal artery, is the largest branch of the hypogastric, and appears to be the continuation of the posterior division of that vessel. It is a short artery which runs backward between the lumbosacral trunk and the first sacral nerve, and, passing out of the pelvis above the upper border of the piriformis, immediately divides into a superficial and a deep branch. Within the pelvis it gives off a few branches to the iliacus, piriformis, and obturator internus, and just previous to quitting that cavity a nutrient artery which enters the ilium. A superficial branch enters the deep surface of the gluteus maximus, and divides into numerous branches, some of which supply the muscle and anastomose with the inferior gluteal, while others perforate the tendinous origin, and supply the integument covering the posterior surface of the sacrum, anastomosing with the posterior branches of the lateral sacral arteries. Deep branch lies under the gluteus medius, and almost immediately subdivides into two. Of these, the superior division, continuing the original course of the vessel, passes along the upper border of the gluteus minimus to the anterior superior spine of the ilium, anastomosing with the deep iliac circumflex artery and the ascending branch of the lateral femoral circumflex artery. The inferior division crosses the gluteus minimus obliquely to the greater trochanter, distributing branches to the glutei, and anastomosis with the lateral femoral circumflex artery. Some branches pierce the gluteus minimus and supply the hip joint. End of section 23. Recording by Ellie, June 2009.